Hi, everybody, and welcome to my latest blog. Today, we're going to be talking about dirty water and why wash or water sanitation and hygiene is vital to stop antimicrobial resistance. Despite improving conditions globally over the last few decades, over 2 billion people still don't have access to basic sanitary facilities. And that's over a quarter of the world's population, according to WaterAid. And that's actually a lot more than the population of the whole of Europe and North America put together. So let's just let that sink in. The WHO's WASH page points out that nearly 830,000 people die every year from diarrheal diseases due to a lack of unsafe water and hand washing facilities, and many of those are children. The term water, sanitation and hygiene, or WASH, describes the public health areas that aim to improve a number of things in order to reduce the chances of people catching diseases, such as having access to clean drinking water, having access to safe toilets that don't leak into the environment, having access to appropriate hand washing facilities, and improved wastewater management. Not only does a lack of access to wash facilities and therefore hygienic practices impact on our health, it's also an environmental, economic, and developmental issue as well. So WASH is very much linked in with the sort of history of epidemics, and there have been many episodes throughout the centuries that, had we known about good WASH practices back then, we could potentially have reduced or maybe even avoided certain epidemics. Diseases such as cholera and typhoid, both of which are spread by the contamination of drinking water or food by the bacteria that causes them, are really good examples. And whilst people have anecdotally implemented control measures at various points, it took up until the middle of the 19th century for large scale forms of good WASH practices to be implemented. And John Snow and the cholera outbreak in London is a really good example, and I've put a link to a good article on that on the blog page. We may know more about how wash-related diseases are transmitted now, but that doesn't mean it's particularly easy to control them, especially in resource-poor settings or in emergency situations such as displacement camps or after environmental disasters. Why is WASH so important then for controlling antimicrobial resistance? So, antimicrobial resistance, or AMR, is when drugs that we use to treat infections no longer work. And you can read more about antimicrobial resistance, so what it is, how it works, and why you should care about it in an article that I've written, and you can link to that from the blog. We use millions of tons of antimicrobials to treat clinical and animal infections every year, as well as using pesticides on our crops. But despite that, microorganisms are forming resistance to every class of antimicrobial that we have available, and there are very few new ones in the research pipeline. You can read more about antimicrobials and why they're so important, again, in a link on the blog. In order to protect the antimicrobials that we use, we need to reduce the amount that we use in total. And this can be done by improving our antimicrobial stewardship practices, and you can read about why they're so important, again, in a link on the blog, or by limiting the amount of infections that we get in the first place. And this is where WASH comes in and where it's so important. The WHO, FAO, and OIE, so that's human health, animal health, and agricultural or sort of environmental health, have an action plan for how WASH facilities can reduce antimicrobial resistance. And it's really, really interesting. And it's a really good read. And again, there's a link. And there's also a good article about how improving WASH can stop antibiotics being used as a quick fix. There are a number of reasons why having good WASH practices will help to reduce the spread of antimicrobial resistance, and it's outlined really clearly in this technical brief from the WHO, OIE, and FAO. But sort of summarised, there's three sort of main problems that we've got. So the first problem is the spread of disease-causing organisms in wastewater. And untreated wastewater is often contaminated with human or animal waste, as well as other organic matter that might carry pathogens. And if these pathogens infect a new host, so for instance, if the host ingests or drinks contaminated water, or the pathogens get into a wound when you've been washing in, say, a river, then they might need treatment with antimicrobials. And how can WASH or good WASH solve that problem? The WHO's technical framework predicts that if everybody, the universal global access to WASH was available, then it could reduce the number of cases of diarrheal diseases in humans by 60%. And in theory, then, it's a huge decrease in the number of antimicrobials that we use to treat them. Problem two is the spread of low pathogenicity organisms. According to a study referenced in the report, 14% of people globally carry a strain of E. coli in their feces that produces extended spectrum beta lactamase enzymes, or ESBLs, which provide resistance to certain antibiotics. If these people's waste get into either wastewater or drinking water, then these E. coli, which don't necessarily cause disease in healthy people, they might infect clinically vulnerable people who are likely to need treatment and to have to use antimicrobials. How can WASH solve this problem? By providing greater access to safe toilets and drinking water, especially in healthcare settings where clinically vulnerable patients are more likely to be. Less vulnerable people and people in general will have less exposure to these pathogens and therefore less likely to get sick and need antimicrobial treatment. The third problem is the release of antimicrobial compounds. And release of these compounds into the environment, either from human feces or from farming or aquatic animals, or disposal of unused antimicrobials into wastewater, may promote resistance by creating conditions that aid the transfer of these resistance genes to other microorganisms in the environment, or even potentially create the emergence of new resistance genes. The report states that up to 80% of the antimicrobial dose administered, so the sort of active ingredient from the tablets that you would take if you were being treated, can be excreted as the active ingredient. And so that's essentially most of the drug that you're taking will then be released into the environment. But this does depend on the class of antimicrobial and how it's used. How can WASH solve that problem? Well, safe disposal of human and animal waste, as well as antimicrobials and their byproducts, is really vital to stop them leaching into the environment and enabling the spread of resistance between environmental and pathogenic organisms. WASH is really important in healthcare settings, especially important to have good WASH facilities, as there is an increased likelihood of infections being present and clinically vulnerable people as well. And there's a really, really good video from WaterAid which explains really beautifully the importance of WASH in healthcare settings, and there's a link on the blog. You can also read about our study about looking into the changes in infection prevention control and WASH, including hand washing, on COVID-19 wards, and how the changes on COVID-19 wards are affecting the types of infections that patients are catching on the wards, and whether they're actually more resistant. And finally, WASH is a One Health problem. And because obviously, when you take into account the fact that WASH principles affect and are directly linked to the environment, considering its implementation as a One Health issue is vital. And as I say, the WHO, FAO, and OIE's definition of WASH and AMR you can find in the links. And there are lots of interesting articles on WASH and AMR in a One Health context in the issue from Global Waters that I have linked again to on the blog.